All right, thank you very much for inviting me to give this talk on treating pain in the hand and wrist. I don't know how many of you here have pain in the hand and wrist, but I am quite sure that at least half of you at some stage would have had some pain in the hand and wrist before and were wondering what to do with it, okay? And then another half probably not even aware of the sensations as you use your hand and wrist every day, okay? It's something that we take for granted so often because we use it all the time in everything that we do, okay? So maybe let's start with a small mindfulness exercise since it's Brahm Center. Okay, so now we just want to focus our attention on the hands, okay? Just put your hands in front of you, okay? Just look at your hands, okay? You can look at the front of the hand, okay? Just don't look at anything else, just the hand, front and the back, okay? See if there's anything unusual or abnormal that you haven't noticed before, okay? While you are doing that, pay attention to the sensations that you can feel your hand at this time. Even if you're not touching anything, if you focus on your hands, you'll notice that you can at least feel the temperature of the air around you, or even the movement of the air if there's a fan or aircon circulating the air in the room. Okay, so even without actually touching anything, you will notice some sensations. Then the next thing is, I want you to close your hands like this and open them slowly. Maybe do them a few times and feel what the feeling is like in the joints. Okay, when you close your hand and open your hand, you will feel some sensations in the joints to tell you that the joints are moving. This is called proprioception. It tells you that your joints are moving, which part of where the joints are positioned in space at this time. If you're having any pain in the joints, this is when you will notice it as well, okay? And you may also notice if you have pain in the hand, in the palm or the back of the hand or the wrist, okay? If you move your wrist as well, up and down and turn around like this, okay? See if you can feel that where there is any pain, which part the pain is located in. This is quite important for when you come to the doctor to tell us about the pain. You want to be able to describe exactly where the pain is. Very often when people come in, they will say, oh, my hand is painful, my wrist is painful. And then you ask them, where's the pain? Then they show a huge area of the hand, you know, but that's not so helpful. If you can pinpoint more or less exactly where the pain is, it makes it very much easier, because then they will tell us what structures, what are the things that could be wrong in the hand. If you don't have any pain, then take a moment to be grateful for a pain-free hand, okay? Because, you know, your hands are so important for you to do things. Most of the time, we are just doing it unconsciously, and we may end up doing too much, overusing the hands, and that causes injuries and pain, okay? So if you don't have any pain at this time, very good, congratulations. It means you have been taking good care of your hands. Okay, so that is a short introduction to being mindful of your hands. It's worthwhile doing this exercise maybe every day, once or twice, or maybe even more, just to check in with your hands to see whether there's any pain, because as I will share with you later on, there are these things called repetitive strain injuries that can lead to a lot of pain in the hand and can cause a lot of problems. And if you can be aware of what your hands are doing, how your hands are feeling, you can take steps to prevent those things from happening before they get to a point where you need treatment. Okay, so now let's go on with the talk. Okay, so as I mentioned before, your hands are very important for getting things done, and it would be very nice to have them pain-free all the time, okay? But unfortunately, sometimes things happen and your hands become painful. So what is this thing that we call pain? Okay, so the International Association for the Study of Pain, there's actually such a thing because pain is such a problem in a lot of areas, not just the hand. So they describe pain as an unpleasant and sensory and emotional experience. So take note that it is both sensory and emotional, okay, not just physical. It's a sign of actual or potential tissue damage. Okay, it means, so basically, pain is a protective mechanism for all of us, okay, because if you don't have this sensation of pain, you won't know when to stop doing things or to run away from something or avoid something. Okay, so if, for example, if you put your hand on something hot and you didn't feel the pain, you won't be able to withdraw your hand quickly. Okay, you keep it there, then your hand will get burned and you wouldn't even know it. And this is what happens with people who have things like diabetes, where their feet, the nerves in their feet are not working, and then they put their feet in hot water and they can get badly burned. Okay, so pain is actually important. It's actually a sign of actual or potential tissue damage. However, it is always subjective. Some people with the same stimulus, that means to say the same injury or same thing that they touch, it causes pain, but the way they see the pain is different for different people. Okay, for example, if I give you an injection, some people might say, okay, it's just like an ant bite, nothing much. Okay, but some people, you give the injection, even before the needle touch the skin, they already feel the pain, and when they touch the skin, they start to jump and scream already because they think it's the most painful thing ever. But it's the same needle, the same injection. Okay? So in that sense, pain is always subjective. Different people will respond to pain differently. And because of that, we say that pain is always a psychological state. It is a state that is created in your mind, okay, based on the physical signal that you receive from the nerves in your hand. The signal travels to your brain, and the way your brain processes it will determine how you respond to the pain. Okay, so there's a physical cause, but it's a psychological state. Let's go through this. Okay, so there are different types of pain. Okay, so there is this thing called nociceptive pain, which is basically the pain that you get from tissue damage. Okay, when something hits you, you knock your hand against something, or you cut your hand, there is a pain sensation. That is called a nociceptive pain. It is because the pain receptors in your hand have been activated and send a signal to your brain. Then there's this thing called neuropathic pain, which is pain caused by abnormal signals in the nerves. Sometimes you don't even have any injury, but you have this pain in your hand. I'm sure some of you may have it, okay? It's kind of tingling sensation and then very severe pain in the hand sometimes for no reason. There's no injury at all, okay? And that is called neuropathic pain. This is caused by abnormal nerve signals because there's something wrong with the nerve, okay? And there's this thing called psychogenic pain, which is a psychological component to the pain, which is a part of all the types of pain. Okay, but sometimes, even in the absence of any physical problems, you may get this feeling that you're in pain. Okay, and this is particularly in people with depression or people with certain psychological conditions where they perceive even normal sensations as pain. Okay, so that sometimes can happen. Okay, and then you can have a pain that is acute or pain that is chronic. Okay, so basically, acute pain is pain that is happening very quickly. Suddenly you have a pain, and chronic pain is pain that slowly builds up over time and is there all the time. May have been there for weeks or months, and there's always a certain amount of pain there. So that's called a chronic pain. Okay. In the hand, what we see is causing this pain. Things are arthritis, injury, infection, or inflammation, nerve compressions or nerve injury, and inflammation of the nerves. These can cause neuropathic pain. And there are things like complex regional pain syndrome, which is another special form of pain, which is mainly psychological, but also based on an initial physical injury that you sustain. The problem with that is that the pain that you feel is totally out of proportion to what you would expect from the injury that you have, or it is there and doesn't go away even when the injury has healed. And that is what we call a complex regional pain syndrome. So when we talk about treating pain, we have to understand how it arises, okay, because then we can treat it. So the first thing is a contact stimulus, okay? You have something that causes an injury or an inflammation, okay? For example, that's me getting my COVID vaccination, okay? There is a needle going in, that is the injury or the stimulus, okay? When that happens in the skin, there are these receptors for pain, okay? These are nerve endings in the skin, and they get activated when there is injury, okay? From there, the signal in the nerve is transmitted through the spinal cord and up to the brain, okay? And on its way up from the spinal cord to the brain, there are areas in the spinal cord which modulate the pain, which means it makes the signal stronger or weaker, okay? And then once you get to the brain, then that is when you perceive the painful sensation. That's when you notice that there is pain. Okay, all this takes a very short amount of time. Okay, it happens in milliseconds. Okay, and what happens is then you register this painful sensation in the brain. And the next thing is you get this fight or flight response. Okay, because once that signal reaches your brain, this thing called the limbic system, which is a very primitive part of the brain, gets activated, and it generates this response for you to withdraw your hand or to do something to get rid of the pain. Okay, and this is called a fight or flight response. Okay, depending on the individual, this response can be very severe, very strong, or and it can cause a very strong emotional response, or it can cause them to do something more physical. Okay, or it can be, you can just take note of it, and then it will, and then you just do what's needed to get away from the pain without much of an emotional response. Okay, so that is how pain originates. Okay, and then you get this thing called suffering. Okay, which is the psychological part of pain. Okay, so how do we treat the pain? Okay, well, the good news is that all you have to do is remove any one of these steps along the pathway, and it will stop the pain from occurring. Okay, because so this what I would call a circuit breaker. Okay, the way to get rid of contact stimulus to stop this from happening is to prevent it. Okay, or if it's already there, then you get rid of it. You take away the needle, then the pain is gone. Okay, so that is how you break this one. Those signals that are generated by the pain, by the stimulus, can be treated with medication. Okay, certain medications will decrease the amount of pain signals that are transmitted to the brain. Okay, things like local anesthetics, things like painkillers. These will decrease the amount of signals of pain signals that reach the brain. Okay, those certain medications can also be used to make the spinal cord process the signals in such a way that it decreases the intensity of the signal that reaches the brain. And so can things like physical therapy. Okay, this is what we call gate control treatment, where we use a non-painful stimulus to stimulate the area, and the spinal cord can then shut down some of the pain signals because it's busy processing these other signals. Okay, and when that happens, then the pain the pain signals that reach the brain are much less. Okay. Then later on, to stop this fight or flight response from generating an intense negative emotional response, mindfulness training and spiritual practices such as meditation and even prayer have all been shown to significantly improve the perception of pain and the response to pain, okay, especially in people with chronic pain. So that is what something that Brahm Center is doing quite very well, training people with these mindfulness practices. It is very applicable for pain. Okay, but if you have acute pain, then this is what you should do. Okay, this is if you have an injury to your hand or wrist, okay, and you suddenly find yourself with a painful hand or wrist, or if it's very swollen, what you should do immediately is stop using the hand. Okay, so straight away stop using the hand and do what we call this RICE treatment, which is rest. So you rest the hand, stop using it, put some ice packs on it. That will help to decrease the swelling, and also the sensation of the cold will help to decrease the pain signals that reach the brain as well. So that's what we call the gate control theory as well. You can use some compression, you can use some bandages to compress to bring down the swelling, and you elevate the hand like this in a sling. Okay, so that keeping the hand up generally decreases the amount of swelling in the hand, and when there's decreased swelling, there's also decreased pain most of the time. If it's very painful when you're moving the hand, okay, when any movement causes pain, it's best to immobilize the hand, okay? You may not have a splint on or available at the time, but it's very easy to get a newspaper like, you know, this magazine here. What you do is you roll it up like that, and then you tape it to your hand and wrist like this so that you can stop moving, okay? So when you stop moving, generally the pain will become much less as well. So that's how to treat acute painful swollen hand and wrist. Of course, you don't stop there. You should see a doctor immediately if the hand is obviously deformed or very swollen, if the pain is very severe, or if the pain or swelling or movement is not improving after a few days. Okay, and these are all signs that something more serious is happening that needs to be treated. Okay, it may not be just a bruise or a sprain that is going to get better by itself. Okay, one warning I have to make here is not that I have anything against traditional medicine practitioners, but I have seen so many cases where people have gone to them with because of pain in the hand or wrist, and they have performed some kind of massage, some kind of manipulation that has made it much worse, because when you go to them, they don't have the full, they don't have the ability to make a full assessment, simply because they don't have this thing called an X-ray. Okay, part of the assessment of this painful acute hand and wrist are to do an X-ray. When you do an X-ray, you see the bones, which you may not see. You may see this is like this. You may think it's just maybe a dislocation or something, and then the practitioner may just pull it and try and set it back into the right position. But actually, the injury is very severe. This is a very badly shattered bone here. By moving it around and pulling it and things, these pieces of bone get more displaced, and then makes the situation much worse, and makes it much worse for us to fix it when they come in. Okay, this one is a dislocation, and as you can see, the deformity, and on the X-ray you can see a dislocation. But if you don't have the X-ray, you wouldn't know whether there's a dislocation or whether there's a fracture and the bone is broken. So again, the treatment is different. Also, you wouldn't know how to pull this back. Sometimes these dislocations, they are complex dislocations where something is blocking the joint and you can't just forcefully pull it back. Okay, so don't. I would advise people not to go for any form of manipulation or anything that is done to treat these painful swollen hands physically until you have at least got an X-ray to see what is going on with the bones. Okay. Other common causes of hand and wrist pain, we'll go through them now. Okay. Basically, we can divide the types of pain in the hand and wrist into three major types. Okay. One is inflammation, one is mechanical, and one is nerve pain. And all three types may exist at the same time, or any combination of one or two types may be present at the same time. So inflammation pain is where there is a throbbing sensation. It's always constant and usually worse on moving. There's always swelling, which is a part of inflammation. It is warm or hot to touch, and it is usually very tender. Okay, and this is these are the characteristics of inflammation. The types of pain that arise from this are like hand infections. Okay, so these are particularly severe forms of inflammation caused by bacteria in the hand, and you get this constant throbbing pain. It may disturb your sleep, and it's usually getting worse over time. Sometimes you may see yellow fluid here, which is pus. Okay, and if you see this, then generally, if your hand is very swollen and painful, and you see some pus there, or if it's getting more and more swollen and painful over the next 2 days or so, then generally speaking, you should see a doctor immediately, because if it is an infection, then you need to have antibiotics immediately, or in fact, you may have to have surgery done to treat this infection properly. If you don't, then it may spread and get worse, and then it can become either, in some cases, especially in patients who have diabetes or on some form of immune suppressants like kidney transplant patients, these infections can get very serious and life-threatening in a short period of time. So if you have this kind of pain, please see a doctor immediately. Okay, don't try to treat it yourself. Don't try to take those herbal remedies or anything like that. Okay. Other forms of inflammation that are more chronic are things like rheumatoid arthritis. This is a form of arthritis where the body produces certain antibodies that attack the joint. Okay, and it causes inflammation in all the joints, but affects the hands particularly badly. Okay, so you may get swelling in the hands. You may get this kind of very big kind of swelling, which is basically a combination of fluid and tissue in the wrist joint here or in the fingers. Over time, the bones may get damaged as well. The joints get deformed, and you get all these kind of deformities in the hand. Okay, so in this case, usually you have pain that just goes on and on. There's usually a low level of pain and stiffness in the joints. It may get worse from time to time, but there's always some level of pain there. Okay, usually it's worse in the morning, and it gets a little bit better when you start doing things. So in these cases, also, if you have pain, and especially if you have family history of this problem, you may know your parents or your grandparents or uncle or auntie or someone who has this kind of problem. It runs in the family. So if you have stiffness and pain and swelling in the hands off and on for more than 3 months, you should see someone. You should see a doctor to get it checked, because we can do blood tests to check on this. We can do x-rays to see if the joints are badly affected. And if the blood tests confirm that you have this problem, then you need to be on long-term medication to suppress all the inflammation and to prevent this from getting worse. Okay, and that will also treat your pain. Gout is another type of inflammation of the joints that is caused by high uric acid in the blood. Okay, the uric acid then comes out of the blood sometimes and deposits around the joints and causes a severe inflammation in the joints. And when it happens, initially it can be very, very painful with hot and swollen joints and very painful movement, and it may be almost unbearable. In these cases, you should always see a doctor as well to make sure it's not an infection, because if it is an infection, which sometimes it could be, then the treatment is a very urgent surgery to get rid of the infection from the joints. Okay. If it's gout, then a blood test will show it. On the blood test, you will see that uric acid is high, and the treatment for that is medication to decrease the inflammation. Over time, if you don't lower the uric acid, then this uric acid deposits will keep building up, and then you get this kind of big swelling around the joint with destruction of the joint as well. So in these cases, then we may need to do surgery to get rid of this to improve your hand function also. So treatment for this is medication and sometimes surgery. Next, moving on to mechanical pain. This is pain that occurs only on certain movements. So when you're not making those movements, or when you're resting, then there's no pain. Okay, only when you perform those particular movements, then there is a pain. Okay, it may be associated with stiffness, with the clicking or clunking sensations in the joint. For example, when you turn your wrist, there may be a click, right, and there's a pain. Okay, or when you move your fingers, there is a click or pain or clunking sensation, and then you feel the pain at the same time. And there's often some degree of inflammation that's happening at the same time. The causes of this kind of mechanical pain, one of the most common one are ligament injuries, where you have injured the joint. Ligaments are those tissues that hold the joint, the bones at the joint together and stabilize the joint so that the joint can move properly. And that is why when you have a ligament injury, you may have this kind of clicking and clunking, because the bones are actually not moving properly and they are rubbing against each other abnormally, and so you get this clicking sensation. Or sometimes the torn ligaments may be getting in between the bone, and then as you move the bone, the ligaments, the torn ligament gets stuck and it clicks as it moves. Okay, so usually there will be a lot of swelling when you have an injury, and the joint will be painful on movement. And when you immobilize the joint and don't move it, it's not painful. Anti-inflammatory medication can help to improve the pain and swelling. And the treatment for it usually is to immobilize the joint to let the ligament heal properly. Okay? Sometimes, if you don't treat them properly and you keep on doing whatever sports or whatever activities that you're doing with the injured ligament, then they have no chance to heal, and then it becomes a chronic pain, which will be very difficult to treat, because then the ligaments have been inflamed and trying to heal for so long that they stop being able to heal properly, and then you need to have surgery to treat them, to repair them. Okay, so the best option is if you have a joint injury and it's very painful, or if the pain is not getting better after a week, then you should see a doctor immediately for assessment. Okay, you may need an MRI scan, which will show the ligaments clearly, or you may need a surgery if the ligaments are very badly injured and the joint is unstable. Other forms of mechanical pain are osteoarthritis. Everybody is going to get this at some stage, some people more than others. Okay, once you get over 50 years, this starts to become more and more of a problem. It's due to aging and wear and tear of the cartilage of the joints. Okay, people with family history also will have more severe form of this problem. So there is a genetic predisposition to it. Young people also may have this problem if you have had injuries to the joints before, because injury to the joints may cause instability. And as I said, when the ligaments are unstable, the bone rub against each other abnormally, and that will cause the cartilage to wear out. Also, if you have deformity of the joint because of the injury, because there's a fracture through the joint, then the bones rub against each other abnormally as well. So that causes an early arthritis in the joints. It steadily progresses as you grow older, because when the joint is worn out and you keep moving it, it increases the wear and tear. Things like anti-inflammatory medications, collagen or turmeric supplements or glucosamine can help with these joint pains. Okay, but basically to minimize the progression, you should decrease or avoid activities that require strong grip or pinching. And that will help to prolong the life of your joint so that it doesn't wear out so quickly. So now, repetitive stress injuries, this is another big group of injuries that can cause mechanical pain. And this happens mainly in younger working people, in the 30s to 50s, or rather I should say younger active people who do activities that require fast and repetitive movements. For example, playing instruments or working on factory assembly lines, or sports people, okay, or keyboard people as well, people who work on keyboards for long hours. Working in awkward positions for long periods of time. These can cause problems to your joints and your hands. Okay, it's very, very common in Singapore because there is a lack of awareness and education. People just don't have so much awareness of this as they do in the West. In the US or Australia, for example, this is a big issue because of workmen's compensation claims. So there is a lot of computer and tablet and phone use around here. Okay, people work long working hours, and recently working from home as well, there's this tendency to keep on working and not take breaks. Okay, and senior citizens doing manual work, which is kind of a big problem in Singapore, I suppose, because seems to be quite a lot of people in especially in hawker centers or even at McDonald's. You can see senior citizens who are doing heavy things like carrying plates and clearing tables and things like that, which they do for hours on end. And as you grow older, the ability to repair all these small minor injuries gets less and less. Okay, so it's very common. Okay, what can happen with this? You can cause trigger digits or trigger finger, which is where you get pain and clicking in the fingers. You know, the fingers may get stuck like this, okay, when you try to close and open, or you may not be able to close the fingers fully and there's pain in the hand, okay. This is usually worse in the morning. Okay, what can you do about it? You can start by avoiding strong gripping, especially those narrow objects, okay. Avoid heavy housework, bringing activities, carrying heavy things, using a mouse which is too small, which requires you to grip harder, and tools with very narrow handles and have a lot of vibration when you use it. Okay, so avoid all these. Tendon exercises like this, as shown here, basically it's like this, and then you go down like this, and go back and up. This is to stretch the tendon so that they can move more through the area which is involved, where they are getting stuck, and to free them up. Okay. Heat with warm water or hot packs is usually very useful for loosening the tendons, and massage and maybe anti-inflammatory medications will help as well. However, in some cases, this will get worse over time because most of us, when we start having this pain here, most people will just carry on using the hand as normal until the time when actually the fingers start getting really stuck or cannot move fully, or it gets locked like this and you cannot straighten it without using the other hand. Okay, and that is the time when you see the doctor. Okay, what do we do? Okay, we can use a splint. Sometimes we give you a device like this to keep the fingers straight so that you can't bend it fully, and that helps to rest the tendon. But that takes a long time. To get it better very quickly, the best way is to give you an injection, which is a bit of steroid into the area where it's inflamed and stuck in the tendon. And 90% of the time, this cures the problem in about 1 to 2 weeks. Okay, although about 30 to 50% of the time it can come back again. And this is usually because the activities that you do, you will go back to doing them, and then the problem can easily come back again. A more permanent solution then is to do a surgery to release the tendons. Okay, And this will give you immediate relief and a permanent cure in 95% of the time. Okay? And after that, regardless of what you do, the problem doesn't come back again. So that is a very effective way to treat it. But of course, most people won't want to do surgery immediately. This is another form of tendon problem. It's called a DeQuervain Tenosynovitis. This is where you have pain at the wrist area near the thumb. Okay, and when you have this kind of problem, when you try to brush your teeth or move your thumb, even opening doors or opening bottles is very painful. So the cause of this is a lot of wringing actions where you twist things, twisting the cloth or carrying baby, or using the mouse in the wrong way, or using your hands for opening tight bottles and things like that. Okay, or using the smartphone. This is increasingly common cause of this problem nowadays. Okay, so these the things that cause this problem, and you should try to minimize them. Particularly those people working with a mouse. Okay, you should you should learn how to use the mouse correctly, which is to keep the wrist straight while you're using the mouse, and don't bend it side to side. Okay. Treatment again is to avoid those activities that cause the pain. You can get things like ergonomic mouse or keyboard. You can stop doing those activities where you are twisting things a lot or carrying heavy baby. For mothers, use a sling to carry baby and a breastfeeding pillow like this for breastfeeding, so that you don't have to support the whole weight of the baby with your hand. Okay. Anti-inflammatory painkillers helps, and using this kind of brace to stop the wrist from moving and the thumb from moving also helps. However, if it's getting worse and it's getting too difficult to do your daily activities, you should, of course, come and see the doctor. And then what we do again, we can give you a steroid injection, in which case, most of the time, you'll get cured, and sometimes it may come back again. Of course, again, the permanent cure is with surgery. If the problem keeps persisting and coming back, then you'll need a surgery to cure this problem. This is a very small surgery, by the way. Another tendon problem around the wrist is on the side of the wrist near the little finger or the pinky finger, and this is called an ECU tendinitis. Okay, this is one of the wrist tendons. Again, caused by using the mouse or the keyboard wrongly, and that's the most common cause of this in Singapore. Okay, although sometimes it may be in cleaners or housewife where they do a lot of wringing activities, again, where you have a lot of twisting force and these tendons are affected. Okay, again, resting, making sure you do use the keyboard correctly, keeping the wrist straight all the time will help. Sometimes you need ultrasound therapy or steroid injections, and very rarely may need surgery. Okay, so those are repetitive strain injuries. There are, of course, a lot more of them, but those are the common ones. And then now we come to nerve pain, which is one of the most difficult type of pain to treat. This kind of pain, fortunately, is not so common. But when it happens, it is important to treat it very quickly and don't let it carry on for too long. So what you have here is when you feel this kind of electric shock kind of sensation, very intense kind of tingling sensation in the fingers or in the hand. Sometimes it can be a burning sensation, feels like very hot or even very cold, freezing, or something crushing the fingers or the hand. Okay, all these are because the nerves are sending abnormal signals to the brain, even though there's nothing there that's causing there's no physical cause of these sensations. You still feel them. This is because the nerve is not working properly. Okay, it comes on spontaneously. So whether you are resting or sitting down doing nothing, in fact, it may be worse when you are sitting doing nothing, because then there's nothing to distract you, and then you notice it more. Okay, so it comes in waves. And you may have numbness, which is decreased sensation at the same time. Very often it disturbs the sleep and wakes people up in the middle of the night, and it improves when it is warm and gets worse when it's cold. Okay, the longer you wait to treat it, the longer it has been there, the harder it is to treat. So for this kind of pain, if you have any of these kind of symptoms, you should see a doctor immediately so that we can find out what is the cause of this pain, and what is the cause will determine what the treatment is. Okay, and once we treat this, if we can treat this pain, treat the cause very quickly, then the pain goes away very quickly as well. But if it's been there for a long time, something happens to the spinal cord and the brain, and it sets up abnormal centers where these signals keep generating even without any cause in the hand. Okay, and then that becomes very, very difficult to treat. So one of the common causes of this pain in the hand is this thing called carpal tunnel syndrome, where there's a compression of the nerve at the wrist. Okay, so that is this area in the hand here. Okay, so the nerve, as it goes through this area here, it becomes compressed because there is too much swelling around the tendons. The tendons go to the fingers, or there is a thickening of this band of tissue that covers the tendons and the nerves. Okay, and when they become compressed, the nerves become very irritated and they start generating all these funny signals, which can sometimes be very painful. The cause of this is prolonged computer use daily, sometimes driving long hours, machine operators, or sometimes even doing a lot of housework. Okay, you notice housework is a very common cause of all this pain in the hand. So again, the thing to take note is that there is a correct way to do all these things with the mouse and the keyboard so that you don't get these problems. And this is especially important when you are using it for long hours. Okay. So what are the symptoms? You get these tingling sensations or even pain and numbness in the thumb, the index finger, the middle finger, and half the ring finger. Okay? Or it may be just one or two of these fingers. Okay. And it's worse in the morning or at night. It may wake you up from sleep. Then if you shake your hand a lot, it will go away sometimes when it's in the early stages. Of course, when it becomes later, then you start losing sensation in the fingers. Okay? And you can get weakness in the thumb. Okay, you can see this one, this is the normal muscle. The muscles can start shrinking in the thumb. And it's more difficult to move the thumb and position it properly to take things. Okay, so that is the later stages. Okay, sometimes this can be due to inflammation of the tendons at the wrist, as I said. And if you try to close your hand and you can't close the fingers properly, and there's a lot of pain around the wrist or the hand area, and you start seeing there's some swelling there, that means that there is some inflammation going on in that area there. Okay? And that is causing too much pressure on the nerve. And the treatment for that is to rest it and take a lot of anti-inflammatory medication to bring down the swelling in that area. Treatment for carpal tunnel syndrome itself, you can, in the early stages, may try to do conservative treatment, which is to avoid those activities that cause this problem. Okay, take breaks very frequently, use a wrist brace or splint when sleeping, and then you can do this same type of exercises to keep the nerve moving at the wrist as well to free it up. But if the symptoms are present for more than 2 weeks and they are affecting your sleep and daily activities, or if there's pain, then you should come and see a doctor quickly. Okay. And what we can do is to start you on some medication, either anti-inflammatory medication or this kind of vitamin B, or even some steroids sometimes. And if that doesn't work, then we need to start you to do some surgery, which we can do a keyhole surgery to release the tightness in this area here. Okay, so this area here, once we relieve the pressure, the nerve will, the function will improve and go back to more or less normal again. But of course, if you wait too long, it doesn't get better so quickly and may be permanently damaged. So don't wait too long to come for if your head is numb. Okay. So now we go to the mindfulness part of it. Okay. Why is that so? Because All these conditions, yes, we can treat you with medication and surgery, but that will only improve or stop the physical component of the pain. Remember that pain is both physical and psychological. Okay, there is a mental and a physical component to pain. Okay, sometimes whatever we try and do, there is no cure. The pain still persists. Okay, or sometimes the treatment for the pain is very risky and may create more problems depending on what the cause of the pain is. And in those cases, then you have to address the mind. Okay, you cannot just address the physical part of it. Okay. So mindfulness in pain management, remember that pain has physical and mental components, and the mind is really the key to all these problems, okay? At least the mental ones, okay? Increased awareness of your hands can prevent painful injuries and worsening pain, and that is where mindfulness can come in. And the other component of mindfulness is where if you go into more advanced part of mindfulness, you have meditation, hypnosis, and certain spiritual practices. They've all been shown in many scientific studies now, proper scientific studies, mind you, in big universities in the US, in the UK, in Australia. They have all shown that your brain activity can change, and this will decrease the perception and the emotional response to pain. And just by doing that, you can decrease your pain significantly. How can mindfulness prevent pain? It can help you to address these three problems, which is ignorance, clinging to habits, and craving, okay, which are three causes of suffering. So ignorance basically means you're not familiar with things like safety protocols at work, which will put you at risk of injury, okay, or unaware of dangers of improper techniques, okay, at the workplace, okay. How many people have a workplace where you have this kind of posture, okay? You work with your neck forward, your shoulders slump forward, you are in some funny position where your hands are not straight, your back is not straight. All of this will cause problems of repetitive strain injuries, as I showed earlier on. Okay, so the proper way to do this is to set up the workstation in a way that keeps you in the most comfortable position to work for long hours. Okay, and make sure you take a break every 30 minutes to do some exercises to, as I said, check in with your hands, see how they're doing, and if they are painful, you should do some exercises, do some stretching to relieve the tightness and the soreness there before you go back to work. And if it is getting more and more painful, then of course you should stop whatever you're doing and really give them a good rest. Okay, old habits, another thing. If you have already got pain in your hand and you keep doing the same thing over and over, the pain is not going to get better. So as far as possible, if you have developed some pain in your hand, you should try to find a way to do things which is different. Okay, change the way you are doing things. There are many ways to do the same thing. Okay, you don't need to wash your clothes by hand. You can put them in the washing machine. You don't need to hang your clothes out here on the pole. You can hang it on this kind of thing where you don't need to load the hands so much. And as I keep saying with the keyboard, because I see so many of these problems, okay, make sure that your wrists are straight when you use the keyboard. So these are examples of habits that we develop over time that we just do automatically and we keep doing even though our hands are painful because we don't know there's another way to do it. So there's always another way. Okay, so that's how mindfulness can help you by making you aware that this is causing the pain. Please find another way and let go of this way of doing things. Okay. Craving. Okay, craving is basically where you want to fit in, you want to be cool, you want to do what everybody else is doing. There's certain things that you really want to do and for whatever reason, okay, but you don't have the proper technique, you may cause problems. You may overdo it and also causing problems with your hands and wrists and cause a lot of injuries, okay? So again, another reason why mindfulness is useful, because if you're mindful of your hand and wrist, you will realize that certain activities are causing pain, okay? And then you also realize that not everyone is suited to do this activity. You don't have to do this particular activity. Okay, if there's pain, stop until it goes away. And if it doesn't stop, then please find something else to do which doesn't cause the pain. You know, these are things that you can do to prevent this pain from getting worse, prevent things from prevent yourself from developing any permanent injuries to your hand and wrist before it gets too late. Okay, and then sometimes this pain, you know, no matter whatever you do, also you can't avoid having some pain. Okay, this is what life is about, basically. Okay, in life, some injury and some pain is inevitable. Everybody is going to get injured at some stage. Everybody's going to get some pain at some stage. Okay, and some of this severe chronic pain just cannot be treated effectively with any medication. So then you really need to turn to the mind. Okay, and the first thing you should do is to stop blaming anyone for this situation that you're in now, and especially yourself. Okay, so that's what we call being kind to the pain, and being kind to yourself with this pain there. Okay, when you do that, straight away you'll notice that the level of pain actually decreases because you have come to some form of acceptance of this pain. Okay, so how does mindfulness help again? So this is what we call the two arrows of pain and suffering. Okay, so if someone is hit by an arrow, then immediately after that is hit by a second one, the person will feel two arrows. So this someone with an untrained mind, which is most people, in terms of this, in terms of pain at least. Okay, when you experience a bodily feeling, you start developing a lot of mental responses to it. Okay, this is what we call the limbic system response. Okay, so worries, grieving, laments, basically you are anxious, you regret, you have all sorts of this psychological reaction to it, okay, which is called the second arrow, which is that of suffering. Okay, so you have two kinds of feeling, a bodily and mental feeling. But you can train your mind. You can train your mind to an extent that when you have this painful feeling, you have very minimal or no psychological component to it. So then you have only a single feeling, which is a bodily feeling, which is just pain. Okay, so then pain becomes just another sensation, and you can live with it. And Brahm Center has this mindfulness in pain management course, which they conduct from time to time. I don't know when the next one is. So please check in with them. They will be able to tell you when the next one is. So if you do have any form of chronic pain, I would suggest this seminar, because this really helps. I mean, I practice meditation myself, and I find that it really helps with even with acute pain. And I have sent patients with chronic pain to Brahm Center for this kind of pain management courses, and they have benefited tremendously from it. Okay, someone's raising the hand. Can I? Okay, can you put the question in the Q&A and I'll answer it later on? Okay, so the final thing is to be kind to your hands. Don't overuse or abuse your hands. Try to protect them from injury. Keep them comfortable as far as possible. Slow down, okay? Give your hands a rest frequently. Be aware of what causes or increases the pain, and let go of any of those activities that are non-essential. Some of those activities which you think are essential, particularly sporting activities, yoga, and this sort of thing, they're actually not so essential. Okay, if you have pain, please drop them. Change the way you do things that are essential. Okay, so that you can minimize the load on the hands and minimize the things that cause the pain. Okay, there's always a different way to do things. Okay. Seek medical treatment early, because as I said, sometimes the longer it's been painful, the harder it is to get rid of pain. Okay, and if you have chronic pain and it's not going away, and no matter what you have tried, all medical, surgical treatment is not working and it's still there, then unfortunately you have to learn to live with it. And the best way to start is to accept it. Okay, so accept it as a companion and a teacher, because really you can learn a lot from this pain. And if you do that, you'll find that it does help, and by changing your psychological response to it, the level of pain actually drops as well.